Hello and welcome to our online symposium on hip surveillance in children with cerebral palsy. My name is Vedant Kulkarni. I'm a pediatric orthopedic surgeon in Shriners Hospitals for Children in Northern California, and it's my pleasure to welcome you to this online format. Let's go ahead and get started. I'd like to start by introducing my colleagues who will be a part of this online symposium. Stacy Miller is a physiotherapist at BC Children's Hospital. John Davids and Amanda Whitaker are my partners at Shriners and UC Davis. And Kerr Graham is at Royal Children's Hospital in Melbourne. And we'd like to go over strategies and technologies to overcome barriers to implementation of hip surveillance during this mini symposium. Even though this is an online format, all of us will be present live, and we hope that you'll put your questions in the chat box so that we can respond to them. I have no disclosures as part of this presentation. To get the most out of this symposium, we recommend that you download the HipScreen app from the Apple App Store or from Google Play. It's free, and we'll be using it at the end of this symposium during our tutorial. Let's start with part one, Introduction of Hip Surveillance. As many of you know, hip surveillance is so important because hip displacement is progressive in children with CP and is present in up to 1 in 3 children. This displacement is silent and slow, with progressive loss of range of motion and progressive displacement on radiographs occurring before there's any pain. And so early identification can help prevent some of these consequences of hip displacement when detected late, such as impaired gait, pain with mobility, and pain with seating. Hip surveillance allows us to identify the issue early. It's defined as a population-based program of regular physical examinations and radiographs for early detection and treatment of hip displacement in children with CP. And our colleagues in Sweden in the early 90s instituted a hip surveillance program and found that over the 20-year course of their hip surveillance program, they were able to completely eliminate hip dislocations and identify hip displacement early, where it could be treated more effectively. Over the 20-year period, you can see a substantial reduction and eventual elimination in hip dislocations. They did so by obtaining radiographs early and measuring the migration percentage, which is the cornerstone to early identification. It's the percentage of the ball or the femoral head that is outside the edge of the socket or acetabulum, with the migration percentage greater than 30%, triggering a referral to a specialty center where treatment can be instituted. Now, the treatment depends on the amount of displacement as measured by the migration percentage. When the migration percentage is under 30%, we monitor and maintain motion of the hips. When mild subluxation is present, preventative surgery with hip tendon lengthenings can be done. The medical risk here is low, and the outcomes can be good to excellent. When the subluxation becomes more severe, hip osteotomies are required. Here, the medical risk is moderate, but the outcomes are still excellent. We want to avoid salvage surgery required for hip dislocations, where the medical risk is moderate and the outcomes are modest at best. And hip surveillance can help identify these issues so that early treatment can be instituted. In Sweden, hip surveillance increased the need for preventative and reconstructive surgeries and eliminated salvage surgery need. In Australia, over the course of 3 years, surveillance increased the amount of preventative surgeries, but importantly, decreased the number of reconstructive surgeries required and eliminated the need for salvage surgeries altogether. These studies have established hip surveillance as the standard of care, and there are multiple guidelines out there. I'd like to go over some of the common features of these guidelines. All of the guidelines stratify the frequency of surveillance by gross motor function classification system, knowing that the percentage of children in those with higher motor impairment with hip displacement is higher, and so the hip surveillance frequency should be more. Additionally, all guidelines will obtain X-rays more frequently before age 8 so that the hip displacement can be caught early and treated more effectively. Most guidelines increase the frequency for this particular group of children with hemiplegia, affecting half of their body, where they have a higher risk of hip dysplasia than their GMFCS would predict. And additionally, some guidelines will continue this surveillance beyond skeletal maturity for scoliosis and pelvic obliquity. This table outlines the initiation year for the 4 major hip surveillance programs and some of the commonalities, as you can see. Now that we've got a roadmap and a basic understanding of hip surveillance, how do we actually institute it? For that, we'll delve into part 2 of our presentation, which is perspectives in hip surveillance implementation. We have 4 experts here who have pre-recorded their presentations and are available live for questions during their presentations. And each of them will go over how they identified and educated the various stakeholders involved in hip surveillance. They'll also talk about how they achieved consensus in their region for hip surveillance. And finally, how they overcame some of the barriers in implementation in their regions. We'll hear first from Stacey Miller, who'll go over the British Columbia experience of population-based hip surveillance. Cara Graham will then go over the Melbourne, Australia experience, where hip surveillance is integrated within clinical care and research. John Davids will go over our California experience, where we have a public and private partnership, a hybrid model, you might say. And finally, Amanda Whitaker will go over her experience during her time at Nationwide Children's, where she instituted a hospital-based hip surveillance program. We hope you enjoy their presentations, and please give us your feedback and questions within the chat box.